neighbors and the citizens were communicated. It is no odd thing that we decided to do this at 7 o'clock in the morning, so when folks are getting up, they know what the facts are. It is a concerted effort, not only with the county and the state and the city, but individuals out there. This morning, Chief Brown, Chief Bright, our city manager, were all working in coordination to accomplish our goals for this morning. Dallas Fire and Rescue went to the 6,000 block of Village Bend Drive, where they began phase 1 of decontamination of the common areas and the areas outside the apartment. Our patient lived alone and with no pets. State of Texas has hired Protect Environmental for phase 2, that inside the apartment and the cleaning of the car and the movement of the same, removing the same. That hopefully will be done early this afternoon. I personally was at the apartment complex this morning and talked to citizens as they were waking up and moving about, which leads us to the second part of our strategy, communication. We worked closely with the apartment managers in creating a strategy that I think is working. Each apartment in their complex the door was knocked on, and we talked to as many people that came to the door as possible. Same time, the apartment complex will be handing out flyers and information to apartment complexes nearby. So we cast the net a little wider. And then we had reverse 911 calls that went out at 6:15 this morning. Meanwhile, we continued to not only monitor the 48 individuals that came in contact with Mr. Duncan, but we take care of Louise and her family who are still in isolation. They are asymptomatic and they are doing well. And as you know, we moved Nina's pet yesterday and are making sure that that pet is well and taken care of at the same time. I think there are two things that I hearken back to this. The only way that we are going to beat this is person by person, moment by moment, detail by detail. We have those protocols in place, the city and county, working closely with the CDC and the hospital. The second is we want to minimize rumors and maximize facts. We want to deal with facts, not fear. And I continue to believe that while Dallas is anxious about this, and with this news this morning, the anxiety level goes up a level, we are not fearful. And I'm pleased and proud of the citizens that I talk to day in and day out, knowing that there is hope if we take care and do what is right in these details. It may get worse before it gets better, but it will get better. With that, we will take a few questions, all right? And but there are a lot of questions we can't answer because either we don't know or because testimony and discussion is going to take place later this week. But we will try to give it a go and give you as much information as we can. We'll start on this side. Go ahead and we'll take a couple questions here and then we'll move to that side. Yes, sir.
Hi, this is for Dr. Vargas, Kevin Sack with the New York Times. Dr. Vargas, talk a little bit about the hospital's view of how this is happening now. I mean, obviously, we're all empathetic with what you guys are going through, but one case can be looked at as a possible breach. It seems like a second case might suggest some sort of systematic institutional problem. Can you
I don't think we have a systematic institutional problem. I think the biggest challenge we have right now is obviously first and foremost the care of the 2 patients that we have and the ongoing screening of folks in the community. Our emergency department has continued to have folks come in. It's a tribute to the information that's been out there in the community about folks to be aware of this symptomatology around Ebola. Our ED's been handling folks through that very appropriately. I think the case of this patient here tonight again shows that the ability to intake those folks, get them into isolation and manage them has been very effective. But we're looking at every element of our personal protective equipment and infection control inside the hospitals. We don't have an answer for this right now, but we're looking at every possible angle around this.
Thank you. Right down here, you raise your hand.
Was this person a nurse?
That is private information. It was part of the healthcare group that helped.
It is a woman. Said she.
She is a woman.
Yeah. Over here, what's the, and then we'll come back. Just go ahead.
Are you awaiting test results on any other patient, any other employees? Because obviously this one was in the work yesterday during the other press.
That is that's the state's decision, and I'll let them speak to that. Later today, there will be a discussion. There will be a joint conference call as normal with the CDC and the state
About this case or about another case?
about this case.
Yeah, and let me, I'm not sure what briefing you're referring to,
CDC briefing.
which was at 1 o'clock in the afternoon,
This person coming forward.
2 o'clock. So there was no test, as far as I know, that was pending at 2 o'clock yesterday.
When did the person come forward?
That's, I don't have the medical records, you know, I've been up all night,
You must know.
but I don't believe there was a blood draw then.
So we can't speak about any of the about any of the details of the patient's case, presentation, et cetera, because it's protected health information at this time. So I'll have to leave it at that.
Dr. Martin,
Okay, right here on the end.
the hospital was very transparent with employees saying that 2 staff members were admitted to the hospital and were being checked out a couple of days ago. Is this one of those 2?
Pardon me, could you repeat
The
that?
hospital told employees that there were 2 staff members who had been admitted a couple of days ago and were being checked out. Was this one of those 2?
No.
Thank you. One.
And follow-up question, there's 3 isolation rooms at the hospital from what I understand. What's going to happen when there's more patients?
You want to take that last part?
Sure.
That's something that's one of the reasons why we'll be leaving here pretty soon. That's something that the CDC and the state public health commissioner and our EOC are looking at along with the hospital, and the CDC will and the hospital will answer those questions later after the data is looked at.
But let me just speak to your capacity question. We have at Presbyterian an emergency room isolation setup. We have an ICU isolation setup where we've let folks in the community know we can manage up to 3 patients. We've also opened a new area within the hospital to expand our capacity for ED screening, and I would emphasize that our biggest focus, in addition to the care of these 2 patients that are in the hospital, is trying to keep our arms around the number of folks who come into the emergency department with concerns about whether or not they've been in contact with folks, et cetera, and then rapidly getting through a screening process for those folks.
2 questions right here, and then I'll come over here.
Luckily with KERA, can someone just give us a sense of the timeline overnight of what happened when the results came through and when the endoscopies went out, sort of the timeline of that?
So I got confirmation at about 1 o'clock. Judge Jenkins had gone up to the hospital. I got in the car, went up and met with him. We met with our city individuals and planned this out. The press, we knew that the press release was going to be happening at 4, so all the police and the fire were there before that. Once the press release happened, we implemented the plans, and they've been working this morning. Okay, thank you. And there was, you've already asked one right there.
Dr. Barger, this is some strong allegations about not proper protective gear for nurses. Your comments are not being handled in this case. You have the equipment you need.
I can't comment on any kind of allegations.
You said that do they have the proper protective gear?
We do.
The question now is,
Okay.
are other hospital
Thank you.
workers being isolated either at their homes or at the hospital? Because if we have two that came down with symptoms very early on, are steps being made that they are isolated now?
And are they still
You're
working?
there.
Yeah, let me,
And that'll be our last comment.
that's gonna be our last comment. We need your help on this. We have 75 people who are hospital workers, and we don't want a situation where people are afraid that if they bump into an asymptomatic person who works at a hospital and has been involved in the care of Mr. Duncan at the Kroger's, that they've been exposed to Ebola. Because what this case further illustrates, these two heroic women's plight illustrates, is Ebola comes from the body fluids of a symptomatic Ebola victim. And that's how they contracted the disease, and that's how Eric Duncan contracted the disease. You don't contract the disease from being around asymptomatic people. They are regularly testing their temperatures. We are going to set up a place where if people want to be away from their family, they have the opportunity to do so. Or if, like Nina, they live alone with their dog and they choose to be monitored there, they can do that. This is not going to be a situation where we're going to put protective orders on 75 healthcare workers. The system right now is working. They are taking their temperature regularly. If they have a slight headache, a slight fever, if they get a chill because the breeze blows, they take their temperature. If they have any temperature or any other, loose stool or any other symptom, they immediately go to isolation in the hospital, and they are tested. And what's that? No, they are not. They are employed but not working.
Thank you, guys. That's it. Appreciate it.